Welcome to a roundtable discussion, Why Komen Central Valley? I'm Sharon Johnson, Executive Director of the Susan G. Komen Central Valley affiliate. Joining me today is Lynn Gilbank, the Project Director who represents Clovis Community Medical Center's Lymphedema Clinic. They are one of the 5 nonprofits who are grant recipients of the Komen Central Valley. You may be wondering what the word grant really means and how we award funds to these 5 agencies. You may have heard about the Komen Race for the Cure in Fresno, which is always held every October. This is a U.S. track and field certified 5K run as well as a non-competitive walk. The purpose of the event is to raise breast cancer awareness and funds for local residents who are uninsured or underinsured. 75% of the net proceeds from our race stays right here in the community to fund these vital programs: screening and diagnostic mammograms, diagnostic ultrasounds, lymphedema treatment, cancer-related legal issues, hospice care, and limited financial assistance so that breast cancer survivors can continue treatment appointments. Once a year, nonprofits submit an application for funding to the affiliate. A grant review committee reviews these applications and scores them. Programs that are funded meet our strict criteria that is based on making education, screening, and treatment available to local women and men. The remaining 25% of the net proceeds from the race funds the grant process through the Komen National Breast Cancer Research. Welcome, Lynn. And I'd also like to introduce Sharon Dietrich, who is a patient that has lymphedema. Lynn, I know that there's some confusion between 2 medical terms, lymphoma and lymphedema. Can you just briefly explain what the differences are?
Well, lymphoma is a type of blood cancer, and lymphedema is a condition that can result sometimes following treatment for breast cancer.
And can you explain what you do as far as your service to any lymphedema patient who is sent to you via referral of a doctor, and also what exactly lymphedema is?
So let's start with what is lymphedema.
Okay.
So lymphedema is an abnormal accumulation of protein-rich fluid in the tissue spaces. So it can cause swelling that's in excess, and with an interruption in the lymphatic system, the fluid is unable to take its normal path and evacuate out of the arm.
So there's methods of helping someone with that type of swelling. What exactly is done?
Well, when a client is referred to our clinic for the first time, as you said, we will do a complete assessment of that person. So we will take measurements of how far they can move their arm, and we measure the circumference of their involved extremity, and we'll look at the functional tasks that they have and any limitations that they may have on their abilities. And then we custom tailor a treatment program to meet their specific needs. And the therapists that work in our clinic are all physical therapists who have gotten additional training, and we're certified lymphedema therapists as well.
Lynn, can you tell me what the dangers are if lymphedema is left untreated?
Yes. If lymphedema is left untreated, we're concerned that the person may develop tissue fibrosis. The skin is very forgiving in lymphedema. It will expand to a great degree, but if left untreated, the tissues and the physical structures actually start to harden, which makes our effect much more limited. The lymphatic system also plays a role in fighting infection. So if the system is compromised, our greatest concern is that the person may develop an infection. And in someone with lymphedema, that can be a life-threatening situation.
Thank you. Sharon, when you found out that you had lymphedema, what were the symptoms you were having?
Well, as Lynn explained, I had movement issues with my arm. Couldn't lift, couldn't raise, and swelling. There was a lot of swelling up here in the upper portion of my arm and right in through here. One of the things that she does for me as my therapist is she moves that fluid for me so that I can actually use my arms, my hands, and have movement.
Is it painful?
No, I wouldn't say it was painful. not being able to raise your arm can cause stress on your muscles and everything. And of course, she's got to work that for me as well, you know, to loosen it up and give me a broader range of movement. And she does that very well.
Well, I appreciate the fact that you're here willing to talk about it, because so many people really don't know what lymphedema is, what the symptoms are. And thank you for wearing your sleeve today. I know that you wear it on a daily basis,
Yes.
but that series of compression is also what helps lessen the swelling, correct?
Yes, yes, it does.
Okay.
Yeah. If I was not to wear it, and if I was to overwork my arm in repetitive motions, then my arm would immediately start to swell again.
Okay.
So this is to keep it down to the size that we need it to be.
Okay.
Yeah.
Now, loss of motion is also a complication if an extremity is swollen. I know that in orthopedics, you always want to make sure that elbows, fingers, and all joints are moving. So that's something else. Do you also do range of motion exercises?
We do therapeutic exercises that will improve the person's range of motion, yes.
Okay. Do you have any advice for breast cancer survivors out there who are experiencing some swelling and really don't know if it's important enough to talk to their doctor about it?
Well, they definitely need to speak to their physician about it. And once they get into therapy, it is very, very important that you keep up your exercises, watch your diet, you know, no salt, none of that stuff, because it will obviously make you swell. It makes anybody swell, but worse if you have lymphedema. And the most important thing that I can say is definitely stay in contact with your physician. Let them know of any changes in your body, because they don't always know. They don't always, you know, see it or recognize it. We as human beings get up every morning and we follow a routine, and we know what is different for us in our range of motions or swellings or whatever. So therapy is the best thing that they can do, and maintaining, like I said, their exercises.
I really appreciate that comment coming from Sharon. We in the clinic will do manual therapy techniques. Sharon alluded to the physical moving of fluid. And one of the greatest things that we focus on in the clinic is teaching the client how to care for themselves. And these concepts that we're teaching them, the person will have to follow through with in order to be successful in the future. And Sharon is a great example of someone who does that very well.
Well, anybody with lymphedema must follow through with everything that their therapist has taught them. Because if they don't follow through, it's like, you know, Lynn gives me the tools to keep my arm where I need it to be. And I can't just keep relying on going back to her to have her fix it all the time.
Mm-hmm.
I have to know how to fix it for myself.
Such as wearing the compression garment?
Yes, very much so.
Okay. Lynn, I just wanted to know, when treating a lymphedema patient, is everybody different as far as the time range that you're able to accomplish some success in lessening the swelling?
Well, there are certain elements of our treatment that the evidence shows that a certain number of weeks, for example, of compression bandaging, that there isn't a great benefit to continuing that on a daily basis beyond a certain number of weeks. So for certain programs, there is a definitive length of time, but you raise a good point that people are individuals and they may learn things at a quicker rate or recover at a different rate than someone else. So that's always taken into account as well.
Thank you so much. Yeah. We're going to take a quick break, and we're going to come back and resume this discussion with Sharon and Lynn. I'd like to thank you for the proclamation, because really what it does is bring a call to action to Fresno County women and men to take charge of their breast health. And as we approach the 15th annual Susan G. Komen Race for the Cure here in Fresno, it's our opportunity to remind everyone that winning the fight against breast cancer is much more than just about curing a medical condition. It's about overcoming cultural, social, educational, and financial barriers that prevent women and men from getting screened and receiving treatment. Since our inception in 1999, I'm proud to say that we have invested $2.8 million in our community and over $800,000 in breast cancer research. So I'd like to thank you very much for joining us in the promise to end breast cancer locally.
And this year, supervisors, I had a landmark when it comes to a cancer diagnosis. I had my 5-year anniversary of being cancer-free. When I can... And at that point, cancer survivors can say cured. And it's only through the efforts of people like Sharon and Susan G. Komen to get the message out there about early detection. And it's because of early detection that I had such a good outcome with my cancer. So thank you for doing this today. We appreciate it, and let's keep getting the word out.
The Susan G. Komen Race for the Cure will be Saturday, October 26th at Fresno State.
Great. Okay, have a motion to approve?
Second.
All in favor, say aye.
Aye.
Come on up.
It's always an honor to receive a proclamation from the Board of Supervisors for Breast Cancer Awareness Month. It brings awareness to breast cancer, the disease about breast cancer, the disparities surrounding this disease, why people aren't getting treatment, and it also brings awareness to breast self-awareness. She's just a delight. I mean, Sheriff Mims has done such wonderful things for the Central Valley when she revealed that she had breast cancer. It could have been a very private journey, and deservedly so. However, she chose to be so selfless when she announced it to the general public about her breast cancer journey. So probably millions of people learned about breast cancer and early detection through Sheriff Mims.
Joke with Kiss Country Morning Show. First of all, yeah! I love all you guys, and I was back just tearing up watching the Parade of Survivors, and one of my good friends, Tina Durbano, her family has gotten together because her mom was a breast cancer survivor, and watching her and her Booby Brigade every year, and they are supporting and doing fundraisers every year. I love you, Tina, and your sister and your mom, and thank you so much for being part of this, every single one of you for being here. It's so emotional for all of us, and I know for you too. So thank you from the bottom of my heart. I really do appreciate it. Letting me be part of this also, so thank you.
I'm Gnarly Charlie, and here's the deal. Why the pirate hat? Because I treasure the chest. Four years ago, my friend Shannon lost her husband. Now, he didn't die, he just left. Became a single mom, got diagnosed with stage 4 breast cancer 4 years ago. That was my introduction to this pink family. And Shannon, I was gonna cry. Shannon had a boob going away party, had a hair going away party, and that's where her story began, and she inspired me and introduced me to all this. And because of people like you and all this pink, it changes lives. Shannon, this year, guess what? She got married. She met a great guy. Her cancer's in remission. She wrote a book. She's an author. It's Okay, Mama Has Cancer. Her name's Shannon O'Brien. Check it out on Facebook. Not only is she surviving, she's thriving. And that's what you're about. Thank you so much, and let's keep this going.
Well, in the Hispanic community, it's kind of hard because a lot of people don't really are aware of what's going on until it finally happens. I have an aunt who was in the same situation. Nobody was aware of it. So when she finally went to a doctor, they're like, "What? It was cancer." So I don't think there is that much involvement in the Hispanic community in cancer at all. And I think it's very important for them to be aware of it. Maybe more programs or more information to them so they're aware, because sometimes it's too late for them to get any help.
welcome back to the Why Komen Roundtable discussion. Again, we're talking to Lynn Gilbank with Clovis Community Medical Center's Lymphedema Clinic and Sharon Dietrich, who is a patient there. Lynn, what type of treatment can you give the patient when it comes to supplies?
Well, in addition to the work we do in the clinic during the treatment session, the manual techniques and the therapeutic exercise that we talked about earlier, we also incorporate the use of bandaging materials. We will wrap a person's arm in many layers of bandages, and that helps evacuate the fluid from the arm. We can also assist the person in obtaining appropriate brassieres and compression pads. We will also obtain for the person the compression sleeve and glove that we spoke about with Sharon. Also donning devices to help women who can't put those sleeves on by themselves. Those are some examples of things that we can help provide to help the person maintain the gains that they've achieved in therapy.
Sharon, have you received any of those supplies?
Yes, I have, and I was one of the more fortunate ones because I actually had Susan G. Komen Central Valley. I received a grant, and that helped me to get those supplies and to get the compression bra and everything else, all the stuff that I personally could not afford. And Susan G. Komen was just fabulous. I wouldn't have been able to do all of my therapy and everything without that.
That's wonderful news to hear, and thank you for sharing that with us. And how fulfilling is it, Lynn, to treat a patient with lymphedema and see all the hard work and see the swelling diminish, the lack of pain? How fulfilling is that?
It's extremely fulfilling. I enjoy my work so much, and the women that come to see me inspire me on a daily basis. And I just so appreciate the hard work and the dedication that I witness every day. And I know sometimes there's a little bit of trepidation because someone's coming into a new situation, but we try to make things a little more relaxed. We try to reassure women and do a lot of education.
And I know that having gone to Lynn, that her dedication and her single-mindedness in taking the fear away and making us comfortable with living with lymphedema for the rest of our lives has just been fantastic.
Well, I'm so glad that I do get to meet a recipient of the services that they are able to provide because of the Komen grant. We're going to take a quick break, and joining me in the return is Jamie Ledesma from Cancer Legal Resource Center.
Ready.
Thank you.
Friends for being here to support them. We're all here because somebody in our life has been affected by cancer. I'm here today because I lost my mother just 5 months ago. She lost her battle with cancer. And I think all of us would recognize and appreciate that cancer really does change lives. It changes our perspective on life. And sometimes, and most of the time, it changes our priorities. And I can tell you it's changed my priorities in not only how I approach my life, but how I approach my work in Sacramento. This year, working with Susan G. Komen and others, we sponsored a bill, AB 1000, which would have brought down the cost of oral chemotherapy. As you know, for those of you that have had to struggle with that issue, you know that for many cancer patients, the out-of-pocket cost for oral chemotherapy could be as high as $10,000 a month. We had a bill in the legislature to reduce that. Under the dome, we had Democrats and Republicans who came together around this issue to push it forward, and we got it all the way to the governor's desk. Now, unfortunately, we couldn't get Governor Brown to agree with us, and he vetoed the bill. So while we weren't successful this year, we're here today to renew our commitment and our resolve to introduce the bill next year. And with all of your help, we're going to get across the finish line and make sure that the governor understands that patients need affordable access to their medication. And so I want to be here today I look forward to walk with all of you here today. I want to commend you, congratulate the survivors for all of your courage.
Okay, is there anything else you guys want to say?
Stephanie Thank you. It's always my pleasure to be here. I wouldn't miss this event, nor my family. We're all here today, and we celebrate you, all of you today. Thank you for including me in this incredible event. I wouldn't miss it. And we have a little goodie for Stephanie.
First Brigade, we won first place again, 4 years in a row. Woo-hoo! We're the Bobby Brigade. We won first place 4 years in a row, raised most money, $12,000. Thanks.
Welcome back. Joining me is Jamie Ledesma. Diagnosed with breast cancer while pregnant at the age of 27, Jamie faced challenges when she was being treated for breast cancer. Angelina Jolie was recently in the news for revealing that she had a double mastectomy and also that she tested positive for BRCA1 gene mutation. Jamie has something in common with Angelina because she also was diagnosed with BRCA1 gene mutation. Jamie, thank you for your willingness to share your story. What importance does family history play in BRCA1?
You know, in terms of really kind of the role that Komen Central Valley has played in and the impact that they've had with breast cancer treatment and survivorship is profound. My grandmother, I have a very strong family history of breast cancer and ovarian cancer on my father's side of the family, and I knew that my entire childhood. I had lost my grandmother to breast cancer in her 50s, and I'd lost a paternal aunt in her 40s to ovarian cancer. And my cousin, my first cousin in her 30s, was diagnosed while pregnant with breast cancer. And so I knew that we had a strong presence of breast cancer in our family, but at the point of me entering kind of this early adulthood, we didn't have genetic testing available. So none of my family members had the benefit of doing a BRCA test or any understanding the genomics surrounding kind of cancer diagnosis. BRCA testing is really important because it not only identifies risk, but it will help a patient like myself who already has a cancer diagnosis determine the appropriate treatment plan for them. And so we're really getting closer to not only a cure, but in the interim, personalized medicine. So for me, when I had a diagnosis at 27, the first question wasn't so much why me, because I knew I had a family history of it. For me, the question was, what should I do about it? What measures and what appropriate medical measures do I need to take? And so I did the genetic testing to see, in fact, what my other risks were associated with the breast cancer. By doing the genetic testing, I did learn that, yes, I'm positive for a genetic mutation, which we now know as BRCA1 or BRCA2. And so that let me know that I did have an increased risk to ovarian cancer and to take the appropriate, more aggressive steps that fit with my lifestyle at the time. But genetic testing really, you know, it's really kind of knowledge is power. And so for me, having that information was really important. Now the rest of my family members, I have 2 brothers. They've decided to do genetic testing also because we know men get breast cancer and they can pass it on to their children. Thankfully, both of my brothers tested negative for the BRCA mutation.
You know, it's good that you're mentioning this because a lot of people who have a little bit of knowledge about the BRCA testing don't understand that it can also come from the father's side of the family, which we know in your case is the truth.
It is the truth, and you know, there's a whole host of factors that come into play in determining whether an individual is should be tested for BRCA 1 or 2. And that decision needs to be discussed with not only your family, but with your medical provider. Family history is a big factor. So if you have a history of breast ovarian cancer in your family, you want to talk to your doctor about that. But also, what are the ages of diagnoses within the family? The younger an individual within the family is diagnosed, the higher risk there is. And then it's also important, there are some populations that have a higher presence of the BRCA gene. So individuals want to take a look at all of those risk factors. In our case, I already had a breast cancer diagnosis, so doing the test really helped give me the information to develop the appropriate treatment plan. But doing the test is also, it's significant, because if you are, and as we see with Angelina Jolie and a lot of other people who've had similar situations, if you test positive for this genetic mutation, your likelihood of getting breast cancer in your lifetime is increased to almost 90%. So it's very important information. But Sharon, you have a lot of information available that I think one of the myths is people think you can only get breast cancer if you have a family history. And that's a myth that we in the community really try to dispel.
In fact, the first diagnosis I had in 1999, although I was in the medical field, the first thing I asked myself, I don't have a family history. How could I be getting this?
Right.
And also, with the second time around, I knew that I didn't have to have a family history. In your opinion, since it's such an intensely personal decision to undergo bilateral mastectomy, how do you think Angelina arrived at that decision? Just because of the odds of developing the breast cancer and ovarian cancer?
The statistics are profound. You know, if you take the likelihood of, you know, prevailing at any event, 90%, you're going to probably take that as a pretty good odd. So in our case, the likelihood of getting cancer at 90% is significant. I think it's interesting in reading some of the pieces that Angelina Jolie has spoken publicly about, kind of her perspective as being a parent. And for young women, this is really important. For me, my decision in taking the more aggressive treatment and choosing a bilateral mastectomy and a prophylactic hysterectomy to reduce my risk of ovarian cancer really was not out of my own sense of security or health, but really a sense of obligation that I owed to ensure my son would have a mom as long as possible. And so I really took aggressive measures to provide a sense of security for my family, less about myself and more about being able to be a mom.
Thank you so much, Jamie. First of all, for being a great grantee and also for sharing your story.
I do want to also mention that if anyone has questions on getting access to genetic testing, the Cancer Legal Resource Center is happy to provide that information in terms of whether or not your insurance will cover this. This test is about $3,000 to $5,000 to undergo, and so for individuals who don't have insurance, it could be a barrier.
Thank you so much. Thank you to the grantees who are Komen Central Valley's lifeline to the community. Why Komen Central Valley? We are the only local nonprofit that funds life-saving breast cancer education, screening, and treatment for our community. I would like to appeal to everyone in the community to step up and register for the Komen Central Valley race, because you never know when the next breast cancer diagnosis could be to your mother, your sister, your wife, or a friend. Join us Saturday, October 26th at Fresno State. Register today online, KomenCentralValley.org.